So what is aortoiliac occlusive disease? It is a type of peripheral artery disease that is caused by the narrowing or blockage of the aorta and iliac artery, which supplies blood to the lower body. It is usually caused by atherosclerosis, where plaque build up in the arterial wall, leading to reduced blood flow. And the risk factor for this disease is usually smoking, diabetes, high blood pressure, and high cholesterol. Next is sign and symptom for patients who have AIOD. So some people have no symptom at all, but these are the symptoms that can be portrayed if someone have AIOD. First is erectile dysfunction. Why people can have erectile dysfunction? Because there is lower blood flow at the lower part of the body. Next is intermittent claudication. So intermittent claudication is usually happens when the leg or the lower limb have cramp or fatigue. It is caused by the lower blood flow to the lower limb. That's why it causes the lower limb to cramp or fatigue. So in order to release this cramp, they need to rest. Okay, next is rest pain, the symptom of rest pain. So usually it happens during the night, during people sleeping, and when you were sleeping, suddenly you feel that your leg is hurting. That is called rest pain. And to relieve the pain is by stretching or move your leg to restore the blood flow at the leg. Last symptom is ulcer. So usually as you can see in this picture, this is the example of people who have AIOD have ulcer on the leg.
Aorta bifemoral bypass is a standard gold surgical treatment where the midline abdominal incision is made and the graft is connected to the aorta just above the blockage, and the other ends of the graft are connected to the femoral arteries in both groins. It's suitable for patients with extensive aortoiliac disease. Next is the extra anatomic bypass, known as rerouting the blood flow using the graft that does not follow the natural part of the aorta and the iliac arteries. Basically, the grafts are placed to bypass the disease segment using the alternative routes. It's similar to the axillobifemoral bypass but can involve with other routes, usually for the patients with severe infections or risk of intra-abdominal surgery. Third is the iliac endarterectomy. The procedure is to remove the atherosclerotic plaque. The iliac artery is exposed via the abdominal incisions, where we remove the plaque and the artery is repaired. Usually it's a limited cases where the disease is localized to the iliac arteries only. Last is the axillobifemoral bypass. A graft is turned from the axillary artery in our armpit to the femoral arteries in the groins. This bypasses the aortoiliac segment entirely. It used for high-risk surgical patients or in cases of infected graft.
Surgical operations plays an important role in the management of aortoiliac occlusive disease. It includes several reasons. The first one is symptom relief and quality of life. The common side effects include claudication or a pain during walking, and in extreme situations, it can cause critical limb ischemia. Early interventions aim to reduce these symptoms and improve mobility to enhance the overall quality of life of the patient. The next one is prevention of complications. Untreated condition can lead to severe complications including limb loss and increase in cardiovascular risk. So the early interventions help in preventing this outcome by restoring the blood flow to the lower extremities and reducing the risk of future amputations. The third one is the medical management. In addition to revascularization, managing modifiable risk factors such as quitting smoking, controlling hypertension, hyperlipidemia, and diabetes, as well as using antiplatelet agents and statin is important. It can help to delay the progression of the disease and will reduce the cardiovascular risk. The last one is improving the long-term outcomes, which is both endovascular procedures and open surgical procedures can provide a long-term patency by lowering the risk of recurrent symptoms and the need for the additional surgeries.
Hi, my name is Nur Fatiha and I'm going to present on the ethical consideration of aortoiliac occlusive disease. So first, informed consent. So patient needs to be fully informed and understand their condition and treatment option like surgery or stenting. This means explaining everything clearly, including the risk and benefit. So for some patients, they might not understand medical terms. So as a healthcare provider, explain to them things in a way that makes sense to them using the simple language or visual if needed. Next is autonomy and shared decision making. Patients should be able to make their own decision about the treatment. As a healthcare provider, we should listen to what the patient wants, considering their personal goals like whether they want to walk more comfortably or just avoid pain. And doctors should also guide the patient but let them make the final decision by helping them weigh the pros and cons to different treatments. Third is risk-benefit analysis. So some treatments like surgery or stents can help but also carry risks like infection or complication. So as a healthcare provider, we must help the patient to understand if the potential benefits are worth the possible risks. Fourth, resource allocation and access to care. Not all patients have equal access to the best treatment. Some might not be able to afford expensive treatment or may live in a place with fewer healthcare options. So it is important to make sure everyone has a fair chance to get the care they need. And also for some treatments are very expensive and this can be a barrier for some people. So healthcare systems have to decide how fairly to distribute the resources. Next is patient preferences versus medical recommendation. So some patients may not want to follow a doctor advice such as refusing surgery. So this might be because of personal beliefs or fear of complication. So as a healthcare provider, we must respect their decision as long as the patient is fully informed about the risk. And last but not least is confidentiality and disclosure. So as a healthcare provider, we need to be honest with patients about how serious their condition and what might happen. So however, some patients may not want to know everything about their prognosis. As a doctor, we must be balanced with honesty and sensitivity to the patient needs. And also some patients might have family member at risk. So if genetic testing recommended, it's important to handle patients' privacy carefully and respect their choice whether to share this information with the family or not. So that's all from me. Thank you.
In conclusion, aortoiliac occlusive disease is a serious condition that can give a significant impact in a patient's quality of life if left untreated. Early diagnosis and timely intervention is very important, whether through endovascular procedure or surgical bypass, to restore the blood flow and relieving the symptom, and also to prevent the complications such as critical limb ischemia or limb loss. Not just clinical management is important, but also addressing ethical, emotional, and psychological consideration to ensure comprehensive patient care. With advancement in minimal invasive technique and improvement of post-treatment support, the outlook for patients with AIOD will continue to improve. That's all from us. With that, we thank you. Thank you for listening to our video.